Just before you start, I've got to introduce you, although obviously your overhead speaks for itself. So our next speaker is Krystal Rothlander.
Thank you. Can everybody hear me? Good. Okay. Good afternoon. My name is Krystal Rothlander. I'm fortunate to be part of the BA Health and Community Services program at the wonderful University of Victoria. I had the pleasure of doing my area focus on the aging population. Today I'll be sharing with you my practical experience at the Seniors Outreach and Resource Center and how I integrated the PHSP skills, values, and knowledge learned from the BA program. More specifically, I will explain how I used effective community engagement to advocate for older adults in Kelowna's strategy to end homelessness. The Seniors Outreach and Resource Center is located in Kelowna, BC, and has been serving the Okanagan since 1987. Seniors Outreach is a nonprofit society working in partnership with organizations striving to enhance the lives of seniors in Kelowna by providing support and linking them to other needed services. We help aging, isolated seniors to maintain their dignity and independence and to stay connected to the community and each other. We provide information on a wide variety of resources and services available to seniors, including not but limited to housing, financial, social, recreational, health, safety, legal, and estate planning. Some specific programs are Better at Home, ElderNet, Elder Guide, regional housing programs, coffee break, volunteer programs, free tax preparation, and the annual Senior Safety Fair. My role at the Seniors Outreach was to plan and organize the 14th Annual Senior Safety Fair that showcases 50 community services and businesses and attracts 300 to 500 older adults, create a frequently asked questions page for website, participate in clerical front-end work in order to understand what drives social policy, and represent seniors in the Journey Task Force Design Labs. Homelessness is a complex issue that requires health providers, stakeholders, policymakers, citizens' lived experiences, and minority groups to collaborate in order to address the needs of sustainable housing for the community. The City of Kelowna is currently facing the same challenges that cities across the nation are experiencing related to homelessness and lack of non-market and affordable housing to meet the community needs. I had the opportunity to attend design labs that were put on through the City of Kelowna and Journey Home Task Force that supports the development of long-term strategy to address homelessness. The name Journey Home reinforces the importance of shifting from traditional methods to new approach of addressing the needs of those at risk for homelessness. The process for developing the Journey Home strategy is designed to be community-driven and inclusive, representing a variety of voices, including those with lived experiences. I had the opportunity to represent seniors during phase 2, which is the community engagement. I attended a series of design labs over the course of 2 weeks, which allowed for a deeper dive into complex issues surrounding homelessness in Kelowna. Turner Strategies was hired to work with the task force to create Kelowna's long-term strategy to address homelessness. Dr. Turner is a leading research with her work on system planning recognized as leading best practice. Dr. Turner led the implementation of Canada's first homelessness program, information system, and also designed Calgary's Housing First system. Most recently, her team worked with Victoria, Edmonton, Yellowknife on their plans to address homelessness. I required every single skill that I learned in the BA program to have the confidence to contribute strategies and tools to the group during each design lab. Each table worked in groups of 5 to 8 while we collaborated and came up with ideas to tackle the homelessness issue in Kelowna. We used a flip chart to record our ideas and presented them to the rest of the attendees. Each flip chart and our voices were documented and transcribed into what will be used for the draft development plan of ending homelessness. The 4 main skills that I used are community development, capacity building, effective communication, interpersonal teams, interprofessional teamwork, and cultural safety. The 3 values that guided my entire practicum placement are interdependent of each other, collaborative action across all sectors, partnerships with peoples with populations served, Indigenous knowledge, and cultural safety. At the beginning of the design labs, facilitators Jamie Rogers, Dr. John Ecker created respect, trust, and partnerships within the group by starting with icebreakers. I was able to identify and participate in the reasoning for this methodology from the PHA values that guided my work. Being appropriately housed with good ventilation, heating and cooling, proper toilets, washing facilities is a determinant of good health. The Journey Task Force Design Labs addressed homelessness by promoting collaboration, coordination of health providers to develop strategies to support vulnerable populations. I required every single skill in the BA program, and attending the design labs and collaborating with hundreds of health professionals reinforced how much information I learned. In my opinion, the BA in Health and Community Services from UVic is innovative, sets the standards for professionalism in the health industry. And thank you so much to my amazing children that have supported me throughout this, Sydney and Ashton, my friends, family, my practicum supervisor, Betty, Betty Taylor, Natalie, and the entire UVic faculty, and my wonderful classmates, and I'm forever grateful for your support. Thank you.
Thank you. Can't go yet. There must be some questions. Oh, all the way up there.
Hi.
Hi.
Congratulations.
Thank
Nicely
you.
done. So I've worked with doing homeless outreach in Vancouver for a bunch of years now, and something I've found really interesting in regards to housing design has been the ongoing conflict between the ideas of designing integrated housing versus exclusive housing. So say elders-specific housing, or in my case, for the work I've done, people living with HIV-specific housing, and there's been a lot of conflict because some people think that's a great design, some people think it should be integrated into other housing models. I wanted to know what your thoughts are on that, or if that has come up for you at all in your work.
No, mainly what we did is there's hundreds of health providers that we gathered together and collaborated, came up with ideas. So some of the ideas we came up with is having a backbone organization. So they would be basically like a one-stop or a non-closed door, like one stop. You could come there, get all your information. And the other thing we discussed was putting cultural safety into workshops for every healthcare provider and having a proper representative for that. And the other thing we discussed is the money that we need, but we did talk with developers, but we didn't really get to that information. So it was basically, we called it the first date, just trying to collaborate, get all our ideas together, and the draft comes together, and then it will be implemented.
Any more questions? If not, I've got one for you.
Yeah.
You mentioned the resource center in Kelowna.
The which center?
The resource center. Where was the funding? Where did that funding for the center come from? And if it was to double, what would you do with it?
Oh, if it was double? Well, right now, the money came from, we did grant proposals to get most of the money. It was nonprofit organization. We discussed in these labs, we talked about figuring out what nonprofit organizations do what, and figuring out what is what we suck at and what we don't want to utilize. So basically, we would figure out where the strengths and weaknesses and of each organization, and then kind of collaborate and bring everybody together. But we do need $49 million to make this happen. No big deal. On top of all the other funding. But when you look at the big picture, it's about $100 million if you think of people going to prisons and police force and medical centers. So then it actually reduces the cost in half if you put everybody if everybody is homed.
Okay, thank you very much. Good, thank you.
Okay.